Hi, this is Dr. Farley, and today I want to be going over with you a little deeper explanation of brain-based care and why, from our perspective, when you look at the three gears that we talked about, why that nervous system is really it is the master system. The nervous system controls and coordinates all the other subsystems, and every cell in your body is in communication through that master nervous system. So how that nervous system goes up or down with function is a major player in your overall health, mentally and physically. And what we want to talk about now is the cerebellum. So the cerebellum is the back and bottom portion of your brain, and really there's 50% of all neurons are in your cerebellum. So this little golf ball sized unit here basically carries 50% of the total neurons of the brain. So it means that there's something very important there when you're looking at overall neurological function. And what you want to know about the cerebellum is it receives constant information from receptors in your skin muscle joints, eyes, ears, smell, taste, and other touch receptors. And on a regular basis, that information is streaming up to your brain, specifically to your cerebellum. And over a time frame, then the cerebellum runs the rest of the brain. So if we're talking about that you want to be healthy physically, mentally, or emotionally, we have to make sure that you have a good cerebellum and that there's proper activation. So those receptors in those skin muscles and joints, which is the majority of the information streaming to the brain, a lot of that information is being sent on a subconscious basis. So what you are consciously aware of coming from your body to your brain is about 50 bits of information per second. What's actually streaming from your body to your brain is about 3 trillion bits of information per second. So by the time you feel bad, we're almost dead. We can have major issues going on, but we can't feel it because the ability to perceive the conscious problem is below our awareness. And there can be major issues happening from a brain and nervous system point of view for a long time frame until the end result, which is I can no longer adapt, and then we finally get the symptom that shows up. So the brain-based care, what you're doing also again is you're activating. Activation again means firing off receptors. We do that mainly here through skin, muscles, joints, smell, taste, touch, vision, hearing. We use all those different modalities to activate the brain to then let it work better so that it allows you to have better mental clarity, emotional balance, and physical function. And because that nervous system controls and coordinates all the other subsystems, everything works better. As the nervous system goes up or down in function, so does your health mentally and physically and emotionally. So over a time frame, when you're coming here for the brain-based care, that's really what it does. We have various different ways of going about doing that. But the impacts are huge. And the three things that will throw the nervous system off, there's 3 types of stress. Physical stress, like falling down the stairs, not moving your body, lack of exercise, lack of movement. Mental emotional stress, we don't have to explain that to you. And then lastly is chemical stress. And chemical stress, in my opinion, probably equals about 80 to 90% of everyone's stress because the foods that you're eating may or may not work for you. They create a chemical, immune, sustained inflammatory response. And then that begins to break the system down because your system gets stuck in a sustained stress response. So the stress response is the hypothalamus pituitary adrenal axis. And if we're driving that from those 3 types of stressors, what we can do is epigenetically we can change the input, meaning we can change how your body sends signals to your brain so the physical stress goes down. We can over a time frame explain to you mental emotional stress and where are you focusing. Are you focusing on where you want to go, or are you focusing on how it's not going to happen? That's a big one. Every day you have to be paying attention to that. Every minute you have to be paying attention to that. Are you in the present moment, or are you stuck in the past or shooting far forward in the future? And then lastly is the chemical stress. What are we sending in? We have to get rid of this word of food, and we have to start using the word called fuel. Fuel recognizes what the purpose of the meal is. The purpose of the meal is to provide fuel for things to work properly. So whether you come here and you're a thyroid patient, you're a Parkinson's patient, you're a dementia patient, you're depression, anxiety, bipolar, a gastrointestinal patient, it's rare that we are not recommending brain-based care unless your tests show that things are working pretty well. And then you may not require that care. But most patients here, I'd say 80% of them, I'm recommending that you do the brain-based care, again, after we run your tests on you. So I hope that you found this interesting and informative. The brain is an important component, and the activation of the brain through receptors in the skin, muscles, joints, eyes, ears, smell, taste, and touch receptors are essential at activating, in a sense, physically turning on those neurons to then run everything else inside your brain. All your subsystems and every cell requires proper communication. So thank you, and I hope you found this interesting.